The causes of baby death in pregnancy during pain, often referred to as intrauterine fetal demise or stillbirth. Some causes include: Number 1. Placental problems. Issues with the placenta, such as placental abruption where the placenta detaches from the uterus too soon, or placental insufficiency where the placenta doesn't provide enough nutrients and oxygen to the baby, can lead to fetal death. Number 2. Infections. Maternal infections, particularly those that affect the placenta or the baby directly, can cause stillbirth. Common infections include bacterial infections, viral infections, and certain sexually transmitted infections. Number 3. Birth defects and genetic disorders. Some babies may have congenital anomalies or genetic disorders that are incompatible with life outside the womb. Number 4. Umbilical cord issues. Problems with the umbilical cord, such as cord prolapse where the cord slips into the birth canal ahead of the baby, or cord accidents where the cord becomes knotted or compressed, can restrict the baby's oxygen supply. Number 5. Chronic health conditions. Maternal health conditions like hypertension, diabetes, or preeclampsia can increase the risk of stillbirth. Number 6. Trauma. Physical trauma to the mother, such as a car accident or a fall, can sometimes lead to fetal death. Number 7. Preterm labor and complications. Early labor and complications related to preterm birth can result in the baby not surviving outside the womb. Number 8. Poor fetal growth. Intrauterine growth restriction, IUGR, where the baby is not growing at the expected rate, can increase the risk of stillbirth. Number 9. Lifestyle factors. Smoking, alcohol consumption, and drug use during pregnancy can increase the risk of fetal demise. Number 10. Maternal age. Advanced maternal age, 35 years and older, can increase the risk of stillbirth due to a higher likelihood of chronic health conditions and complications. Number 11. Multiple pregnancies. Pregnancies with multiples, twins, triplets, have a higher risk of complications, including stillbirth, due to factors like preterm labor and placental issues. Number 12. Obesity. Maternal obesity is associated with an increased risk of stillbirth due to potential complications like gestational diabetes, hypertension, and sleep apnea. Number 13. Autoimmune disorders. Conditions such as lupus and antiphospholipid syndrome can increase the risk of stillbirth due to blood clotting issues and placental problems. Number 14. Amniotic fluid abnormalities. Both polyhydramnios, excess amniotic fluid, and oligohydramnios, too little amniotic fluid, can lead to complications that increase the risk of fetal death. Number 15. Previous stillbirth. A history of stillbirth can increase the risk of recurrence in subsequent pregnancies. Number 16. Thrombophilia. Blood clotting disorders can lead to complications like placental insufficiency and preeclampsia, which can increase the risk of stillbirth. Number 17. Environmental exposures. Exposure to environmental toxins, such as certain chemicals, pollutants, and radiation, can increase the risk of stillbirth. Number 18. Chronic hypertension. Persistent high blood pressure before or during pregnancy can lead to conditions like preeclampsia, which increases the risk of stillbirth. Number 19. Diabetes. Both pre-existing diabetes and gestational diabetes can increase the risk of fetal demise. Number 20. Rh incompatibility. If the mother and baby have incompatible blood types, it can lead to hemolytic disease of the newborn, which can cause stillbirth if untreated. Number 21. Substance abuse. Illicit drug use during pregnancy can significantly increase the risk of stillbirth due to their harmful effects on the placenta and fetus. Number 22. Anemia. Severe anemia in the mother can reduce the oxygen supply to the fetus, increasing the risk of stillbirth. Number 23. Mental health conditions. Severe stress, depression, and anxiety can negatively impact pregnancy. Thank you so much for watching. I hope you found this video helpful and informative. If you did, please give it a thumbs up and share it with others who might benefit from it.